Welcome everyone. This is part one of a two-part series on a labral stretch. So kind of a misnomer here because the labrum is a passive structure in your shoulder that cannot actually be stretched. But I want to get out of the line of thinking of there's nothing I can do about this labral problem and into the mindset of it's like a muscle and it can be stretched because there are, as you'll see through this explanation, some underlying concepts of what a stretch might sound like and how it's a little bit different with the labrum. So I give this stretch a lot to my overhead athletes, people that have had cumulative 10, 20, 30 years of micro trauma to the shoulder, generally with people working overhead. So whether that's a pitcher or a swimmer or anyone that is working above head might have trouble with this. What is it? We're going to go over here to this little diagram. So I've kind of resected the humerus out of the body of the shoulder to display the labrum, which is kind of a rubbery protective pad that houses the humerus. Just to give you, we're kind of looking from the side. Your shoulder blade is your scapula, the biceps tendon attaches into the labrum, and then the supraspinatus kind of sits underneath the clavicle joint. And that often is a corresponding problem with people with labral problems, is that they have decreased space under their acromion. So this might be an exercise that could be applicable to that patient. So one of the big important things that just over time of doing these overhead activities is that we just get used to this like reaching up part, and that is where we kind of get these overdeveloped muscles up top, and this can compromise the labrum over time. So biomechanically, as the shoulder raises, it also wants to slide down. So with every up motion, there's a downward force to pull, to glide it down, to keep your humeral head in the labral joint, covering the most surfaces that it can. So over time, generally what I see with the labral tears, which might also be called a slap tear, is damage on an image kind of in this region. So the top half of the labrum, that's going to be a slap tear, and that's most particularly what this stretch is for. So that is the what. The when is anytime you're rehabbing a shoulder, or if you're trying to stave off injury and more of a preventative measure, this would be a good exercise to try. Where is kind of two parts. So part two, you'll find a little bit more on how the where breaks down. But really for this stretch, just like if you were stretching your bicep, you'd pull your arm down, but you also might pull it back. We really want to minimize the cumulative effects of the shoulder joint. So the shoulder operates not only at this glenohumeral joint, but also the shoulder joint, the AC joint up here, the scapula is going to rotate, and then you're also going to get some thoracic motion. So we want to limit all of that during this labral stretch. How? We'll find out in part two. And overall, as you might see with this labral stretch, we are going to be learning how to move away from pain. So whereas you might have worn out this top half of your labrum, we're going to teach you how to access the bottom of your labrum without surgery, without injections. So stay tuned for part two, and I'll see you there.